This technique here is in the case where you're having an extremely difficult time getting someone to fire up the transversus abdominis or the multifidus, but most particularly the multifidus. This is a little technique I learnt back in Portland, Oregon from a mentor of mine. And it seems to work pretty religiously in terms of being able to fire the multifidus muscle and help to give the patient an understanding of exactly what is going on at that muscle. So the patient will lie side-lying and they'll extend their upper arm. And you just hold their arm between your hip, between my hip, and my hand, and palpate the muscle of the multifidus down low. It's very broad-based in the low lumbar spine. And what I'm going to do is I'm going to ask him to resist me as I move down into extension. Relax. And then as I bring that contraction on, and he resists me, the multifidus muscle on the contralateral side, so on the bottom side, will fire. And what you'll feel there is just a very gentle, subtle, you don't want the ropey erector spinae to come up. What you'll feel is just a gentle, broad-banded contraction in the lower muscle, and that's how, then what you can do is have the patient actually palpate that. Usually they'll have to palpate it with their other hand underneath. But you can repeat that test, and then he can feel that muscle contraction coming up. And it's important to get them to differentiate between the palpation, the erector spinae muscle, and the multifidus muscle. You can then give them that as a home exercise program with some TheraBand, or you can go back into the prone position, and generally they'll find it a little bit harder, a little bit easier now to do the technique in prone as we originally wanted to do. And that's in addition to the substitution strategies also of the pelvic floor, and also when we're talking about the halting urination for the men and squeezing something for the women. So this is sort of the final repose if you have not been able to get them to do any techniques.